It took 7 million years to engineer the human spine. We traded the simple arch of animals that walk on 4 legs for a vertically stacked S-curve. This highly specialized spring allows us to perfectly balance our heavy heads while walking upright. But in the last 2 decades, we have forced that ancient architecture into a completely unnatural shape. When you sit up straight, your head places about 10 to 12 pounds of weight on your neck. But as your head tilts forward, that weight multiplies. Computer models show that when you tilt your head 60 degrees down to look at a screen, it is fighting 60 pounds of stress. That is the equivalent of hanging a bowling ball from the delicate bones of your upper spine. And the average smartphone user spends over 1,000 hours a year locked in this terrible position. Your body doesn't just passively deal with this kind of strain. It actually changes its shape to survive it. This leads to a total posture collapse. The muscles in your chest permanently shorten and pull your shoulders inward, while the muscles in your mid-back become overstretched and completely weak. But the real structural damage happens inside your fascia. Fascia is the web of connective tissue that wraps every single muscle and nerve in your body. It relies on a natural lubricant to stay healthy. When you move around, your body heat keeps this lubricant fluid and slippery. But when you stare rigidly at a monitor for hours, the lack of movement causes the fascia to dry out and thicken into a dense glue. This literally locks your tissues together. At the same time, the constant 60-pound tension on the back of your neck triggers specific repair cells. These cells lay down thick bundles of collagen and pull the tissue tighter to prevent your neck from snapping. This physical collapse is triggering 2 very different kinds of pain in the modern workforce, and they require 2 entirely different solutions. First, there is fast pain. This is the sharp, sudden pain, the tension headaches, the neck spasms, and the general body aches. When your head constantly hangs forward, the tiny muscles at the base of your skull lock up into a severe cramp to act as an emergency brake. As they tighten, they physically crush the major nerves passing through your neck. This causes shooting electrical headaches that radiate over your scalp. When you are hit with this kind of sudden, fast pain, you need immediate, rapid relief. This is exactly where an effective pain pill is not just useful, but absolutely necessary to break the pain cycle, reduce the sudden inflammation, and allow you to actually function. But then there is the second category, bone and joint health. This is the long-term structural damage, where pain is just a warning sign of a deeper failure. When you sit in an office chair all day, your hips are locked at a 90-degree angle. Your nervous system actively shuts down the connection to your glutes, your hip muscles, to prevent them from tearing. Over time, these muscles experience amnesia. They physically shrink and simply forget how to work. Without your glutes to support your pelvis, the massive weight of your body shifts entirely onto the delicate discs of your lower back. Studies show that moving from a standing position to a slumped, unsupported sitting position skyrockets the crushing force inside your lower spinal discs by over 60%. This immense pressure crushes the front of the discs, perfectly setting the stage for slipped discs and early onset arthritis. And finally, this bad posture actually hijacks your nervous system. When your shoulders round forward, your chest caves inward. This severely limits the amount of space your lungs have to expand. It practically paralyzes your diaphragm, forcing your body to rely on shallow chest breathing, using the small muscles in your neck. Deep belly breathing normally massages a major nerve that tells your brain to activate your rest and digest mode, but a slumped posture starves this nerve of that stimulation. The shallow, strained chest breathing perfectly mimics what happens during a panic attack. Your brain misinterprets this as a constant threat, locking your body into a permanent state of high stress. You aren't just giving yourself back pain, you are mechanically hardwiring your brain into a state of chronic, low-grade anxiety. The reality of this structural decay is hitting younger people at an alarming speed. A recent survey of Generation Z revealed that the vast majority experienced their first onset of chronic neck or back pain before they even reached the age of 16. And X-rays of teenagers show that up to 89% have already lost the natural, healthy curve in their neck, replacing it with a rigid, straightened column of bone. When the fast pain hits, the tension headaches and the muscle spasms, use the right pain relief tools to get rapid help and break the cycle. But to protect your bone and joint health from permanent arthritis, you have to change how you move. Stand up, pull your shoulders back, and take the 60-pound weight off your neck.
Mega, we care.